We begin tonight with the latest on COVID-19. The number of confirmed cases in the Philippines has doubled overnight. JC Cosico is joining us live from the DOH headquarters in Manila to give us the details. JC.
Yes, Robbie, the number of confirmed cases of COVID-19 in the Philippines has reached 20. This after the DOH reported 10 new cases today. Based on the profiles provided by the agency, all 10 new cases are Filipinos with ages ranging from 24 to 72. 8 are men while 2 are women. 3 of them have no travel history. 4 of the patients went to COVID-19 hit countries while 2 were exposed to known cases. From February 29 to March 3, the 10 have experienced flu-like symptoms. 2 of them have pre-existing medical conditions such as hypertension. 9 of the patients were admitted to several private hospitals in Metro Manila, including in Makati, Taguig, Pasig, Parañaque, and Quezon City. 1 is admitted at the RITM. DOH ASIC Maria Rosario Vergeri said additional teams have been deployed to work on the contact tracing. She maintained it is premature to declare that there is a community transmission or put the infected areas on lockdown, as health officials continue to work on gathering relevant information.
Para masabi mo may community transmission ka kapag ang mga kaso mo ay hindi na linked to each other.
She added they're also trying to know if the new cases are connected to those previously confirmed.
Kaya nga po inaalam natin lahat itong mga kasong ito sa ngayon para makita natin if there are linkages between and among all of these positive cases that we have. On Sunday, the DOH reported 4 additional cases. 2 had recent travel histories, while the other 2 had contact with confirmed COVID-19 cases. The DOH said cases 7 to 10 are currently admitted to hospitals and are now in stable condition. Robbie, right now the contact tracing is ongoing for cases number 4 to 10, and so far 400 individuals or over 400 individuals have been traced. Robbie?
Maraming salamat. That was JC Cosico reporting live from Manila. All over Metro Manila and in parts of Luzon, LGUs have been taking their own initiatives to address the COVID crisis. Marian Enriquez joins us from the newsroom.
Robbie, LGUs are taking matters in their own hands. Various cities are already putting up protocols and suspending mass gatherings in an attempt to contain the disease. Starting with Quezon City, Mayor Joy Belmonte has ordered for contact tracing and containment measures. A patient who tested positive for COVID-19 has been admitted at a hospital in Quezon City. Isolation areas and triage have also been prepared in some of the city's hospitals. In Pasig, a case was confined at the medical city in Pasig, while another Pasigueño was confined in a hospital outside the city. Mayor Vico Soto ordered officials to cancel all public events and applications for permits for large events. This is on top of contact tracing and disinfecting. Over in Marikina, Mayor Marcelino Teodoro held an emergency meeting with teachers and city workers after a resident with travel history in South Korea tested positive for COVID-19. He ordered disinfection activities in public places. San Juan City Mayor Francis Zamora, meanwhile, suspended all government-related activities after a man in Green Hills tested positive for COVID-19. Private subdivisions were also asked to take precautionary measures. Cainta Mayor Kit Nieto has also begun stockpiling on infrared thermometer scanners and surgical masks for distribution after a couple in the city tested positive for COVID-19. In Lingayen, the LGU assures proactive steps after a patient from Australia that tested positive for the disease reportedly traveled to Lingayen to attend gatherings. Finally, Mandaluyong City Mayor Menchi Abalos is taking precautionary measures to protect senior citizens. In a statement, the mayor ordered the cancellation of social gatherings for seniors as they are the sector most at risk. As the number of COVID-19 cases rise in Metro Manila, Albay Representative Joey Salceda is calling for an NCR lockdown. This means a temporary work suspension, flight cancellation, and the closure of the South and North Luzon expressways. Salceda is also proposing a nationwide class suspension. Back to you, Robbie.
President Duterte has officially declared a state of public health emergency. What does that mean? Health Secretary Francisco Duque says that first, the state of emergency will facilitate the urgent release of funds, especially for local government units. Second, it should streamline the procurement process for materials and equipment needed to combat the outbreak. Third, it will mandate all hospitals, including private institutions, to report to the DOH. This should enhance government's ability to detect, isolate, and contact trace infected persons as quickly as possible. Finally, the declaration will, once justified, mandate everyone to adhere to the department's directives on quarantine. The fifth one is already being implemented, the imposition of travel restrictions. Finally, it will authorize the DOH and DTI to implement a price freeze on crucial items like personal protective equipment, including masks, goggles, and hazmat suits. Meanwhile, the difference between Duterte's order to the agency's code red sub-level 1 is that the alert level triggers the recommendation for the emergency declaration. Under DOH guidelines, code red also means 100% of hospital personnel must report for duty.